Hi, I'm Victoria.
I'm Jamie.
I'm Chalia.
And
We're going to talk to you about DVTs, also known as deep vein thrombosis,
Or blood clots.
blood clots. So I will talk to you about some of the signs and symptoms that you would look for when looking for DVT. So maybe you have a past history of being a smoker, or you've had a previous DVT, or you have hypertension. All could be potential risk factors. But some of the things that you would look for physically in your legs, one leg might be a little bit more swollen than the other leg. You may have some redness. You may have purple or blue looking toes. It's just a decrease of oxygen getting to those areas. So those are some of the things that you would look for, and you would want to call your provider if you notice any of those things.
Once you've noticed those things, your provider will probably want you to do some diagnostic testing and some labs. So the first lab that they usually do is called a D-dimer lab. It's just a blood draw, and with that, it doesn't diagnose a DVT, but it will tell you if you have increased clotting happening, which is what they're looking for. So if you don't have the increased clotting, then they can officially rule out a DVT. But if you do have increased clotting, then they're going to want to do further diagnostics to see if you potentially do have a DVT. So other diagnostics would be doing an ultrasound. They do an ultrasound on your veins to see the blood circulation, see the blood flow. There's also a Doppler that they can do that they usually use with DVTs that are a little bit higher up near your torso. There's also a more expensive procedure that they do that involves surgery, where they insert a catheter into your leg actually and inject dye. That one is very definitive of having a DVT diagnosis. But like I said, it's very expensive and not done that frequently. You can also get an MRI done, and that as well is pretty, it's an extensive test. Like usually they will just go with the ultrasound or the Doppler, and that's non-invasive. Just getting good imagery of your veins and seeing if you have any clots there.
Okay, so say that you did go to the doctor, your leg's swollen, you went to the doctor, you got a blood clot. What now? So what your doctor's normally going to do is put you on some blood thinners. So that just prevents further clotting of your blood. So a few medications that you might hear of are heparin, also known as Inoheb, warfarin or Coumadin, Eliquis, and then Levoxin. So another thing they'll probably do is use this thing called thrombolytics, which is, the common name is called the clot buster. That will actually dissolve the blood clot that's in, say, your leg. And it will, it's administered by a doctor, so it's not like a common thing. And as soon as that's dissolved, we will stop those thrombolytics. Another thing that can be done is actually called, it's a surgical procedure called a thrombectomy. So they just go in and surgically remove that clot. And then, and if none of those other procedures can be done, they might put a filter in to keep that clot from moving to your heart, because that's where we get the serious complications, is if it moves to your heart and into your lungs. That is called the inferior vena cava filter. And then we're also just going to try to prevent this from happening again. So move, drink water, do little leg exercises, wear compression socks, and Drink lots of fluids. Did I say that already? Drink lots
Yeah,
of
because
fluids.
a sedentary life, if you're just kind of sitting around, not doing a lot, those kinds of things can also be risk factors for DVTs. So like she mentioned, get up, move around. And if you do notice any of those things, definitely call your provider.
Mm-hmm.